Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. There are 3 primary ways you can join our broadcast. Join us live by clicking the link in this video description and following the instructions to allow access to your camera and microphone. Then, a show moderator will be available to assist you further. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hello and welcome everybody to AFSPA Live. This is your opportunity to ask questions that you have. So I want to remind everybody to please share your thoughts in the comments below. And this month, we're going to be covering children's healthcare. We've actually already released 2 podcast episodes on our podcast, AFSPA Talks. One was covering pregnancy and newborns, and the other one was focused more on children's behavioral health. So please check out our podcast, AFSPA Talks, through our website or on our YouTube channel at AFSPA Cares. And as a final reminder, I just want to let everybody know that AFSPA Live always occurs on the last Thursday of every month at 11 a.m. Eastern. And without further ado, I'd like to hand it off to Kyle and our guests.
Drew, thanks so much. And I'm delighted that we have a better episode for you this month than we did last month because it's more than just me answering your questions. We are excited to welcome Honora Einhorn, who is a licensed independent clinical social worker, and Allison Stoner, who is a clinical psychologist. Both of them are clinical managers with Brightline Health. And we announced earlier this month a new partnership with Brightline Health. And I'm so glad they could join us. They also were on our podcast that we released earlier this week on Monday. So you can go listen to that and hear more about our partnership with Brightline, as well as some of the information that Honora and Allison were able to share with us. Honora, Allison, thank you so much for joining us today.
Happy to be here.
Thanks for having us.
All right, so you all have the expertise in behavioral health, and I know this is something that we talked about separately. Obviously, we explored on the podcast, and we've had some questions from our membership that have come in ahead of time. So, Drew, do we have any questions that are already available?
Yeah, absolutely. Let me line this one up for you guys right here. So one of our members is asking, in what ways has COVID affected children behaviorally?
Allison, I'll turn to you for this one, at least to get us started.
Of course. Thanks, Kyle. So we've certainly seen a lot of behavioral and emotional impacts from the COVID-19 pandemic. And although we're in a new phase now, there's certainly lingering experiences. And so I think one of the primary ways that the pandemic has impacted kids behaviorally is through social isolation. And that kind of how this looks might depend on developmental age. So for younger kiddos, just less opportunities to engage with other same age peers and kind of practice getting to know one another and do kind of social problem solving. We see that too in our earlier elementary aged kids, that there's less given the isolation. They may have not been in schools, and having those social problem solving opportunities and also kind of learning how to do school, sitting, following directions, being a part of routines. And then for our adolescents, we see the pandemic kind of impacting how they interact with others. So lots more interaction via social media and online interactions, maybe through gaming and things like that. And lots of teens and preteens talking about almost having 2 ways that they present themselves, like in real life and then online, and thinking about how, what an experience that might be to have to hold those 2 kind of different selves.
It's great. And we were able to explore that in depth on the podcast. And I appreciate that was a very, very good summary of sort of how different age groups are, are experiencing and acting. And here we are 2.5 years later. And still, we had an hour-long town hall last night for one of my kids' schools to talk about COVID precautions and what that may mean and so forth. So it's very much a part of our everyday life. Thank you very much, Allison. Drew, what else do we have?
Yeah, I think going off of that would be a good time to ask this question, where it would be, how do I know if my child needs extra support? That's kind of a loaded one, but please take it away.
Yeah, Honor, we'll throw this to you. And when we're
Absolutely.
talking about behavioral health needs, what do we see? What are we looking for?
Yeah, happy to speak on this. Ultimately and clinically, we think about two areas to focus on if we're concerned about needing a higher level of care or support. Namely the distress, whether that's explicitly stated or you witness it as a parent or caregiver. So witnessing your child maybe increased emotional outburst, tearfulness, a significant change in emotional distress, or they name for you that they're distressed, really considering just, emotional, psychological distress. And in addition, we also think about impairment. So are you witnessing impairment for your child or functional impairment rather, in multiple settings? So challenges at home, with siblings or with family, challenges at school, whether that's academically speaking or socially, as well as disruptions in friendships. So primarily we think about, both functional impairment if you're witnessing that, as well as distress. And then I would be monitoring as a parent or caregiver, being mindful about, the frequency of both of these things, the duration and the severity that you're witnessing.
And Honor, we explored this a little bit in the podcast as well. We've been able to both this, but also that a parent's observation or a caregiver's observation is not the only one we have to rely on. That there are others who are spending time with children and can be a good resource. I wonder if you could revisit that for us, as we discussed it in the podcast.
Absolutely. So, as even as I spoke to sort of, functional changes or distress in multiple settings, we were talking about multiple settings. So there's other caregivers and other stakeholders that are monitoring and could have insight around what's happening for your child. So definitely, particularly for school-age children, I would be thinking about the teacher or the teachers that are in a classroom to check in with and ask about how things are going in the classroom. You can also reach out to other school-based supports, which could be the counselor. In addition, we would absolutely recommend reaching out to your child's primary care provider or pediatrician. These are really key personnel and skilled individuals, professionals who have also a very solid understanding of child development and can speak to sort of concerns and name them and discuss them and share with you. I don't know if Allison, you have anything to add to that.
Thanks, Honor. I think those are some really key stakeholders and key players for kind of getting that collateral information. Really, anyone that knows your kid well. I mean, I think we think about how, although maybe we as caregivers are the experts in our child at home, there's lots of other environments that they live in, because they don't exist in a vacuum, right? So if your child might be someone who participates in extracurriculars and has a special relationship with their coach, or maybe they're in scouts or a part of drama or something like that, is there another adult who knows your child well in one of those sorts of contexts? Maybe you have another adult caregiver that's regularly interacting with them. Perhaps it's another family member, babysitter. Those sorts of folks too can be helpful to just kind of get a sense of what's going on when maybe you're not there. And I think also, has there been a change? And I think we talked about that a little bit on the podcast, right? So how do I know if I need support? It could be that this is a longstanding concern, but if all of a sudden you start to get that sense in your gut that something's different, getting confirmation from others who spend a lot of time with your kiddo might be helpful too. Are you noticing a difference too? And kind of engaging in that conversation and shared, so that you can have a more comprehensive understanding of how your child is kind kind of existing in all those other places and spaces where they live.
Thanks, Allison.
A holistic experience, even, or at least a holistic view, even if we can't be there at every moment. But relying on others, I think that's great. And even places where you might not think to look, coaches and so forth. That's great. Drew, do we have anything from members?
Absolutely. I would like to bring up a voicemail that we got submitted before the show, and I want to just remind everybody as well, we do have multiple ways for you to interact, so please continue sharing your comments. You can also try to ask a question if you'd like beforehand through a voicemail, and I'm just going to bring this one right here for you all.
Good morning. My name is Shelley Cornegay. I'm calling from the U.S. Department of State. I am the Agency Benefits Officer, and I get a question often from our employees regarding how often should children attend well child visits? Can you provide any guidance around this? Thank you so much.
So we are covering sort of the broad spectrum of everything for care for children. So I will not turn to Allison and Honora here, but I will just share with, first of all, Shelley, thanks for calling in and thanks for your partnership. We love working with you and your colleagues at the Department of State. I would point anybody who asks about that first to their pediatrician, because they have a great schedule of what's needed in terms of child visits, immunizations, and so forth, and they can share that. If someone, as often happens with Department of State employees, is moving and they're trying to track some of that themselves and keep up with it, they can also go to healthychildren.org, and this is a resource published by the American Academy of Pediatrics, and this has information about child visits at every stage of life, including when you're going week 1, week 2, month 1, month 2, etc., all the way into the teen years. And but there's at the top of that page, there is a menu called Ages and Stages, and that's where you'll find that information, checkups, immunizations, and so forth. You can also look at the United States Preventative Services Task Force. I'm not going to try to pronounce that acronym. I have colleagues who it rolls off their tongue, but they have recommendations for people of every age and what preventive services are recommended, and whether it's an A or a B and so forth. And we have the coverage details of that in our brochure for the Foreign Service Benefit Plan. But I would point people first to healthychildren.org from the American Academy of Pediatrics. I think that's a good place to go. But on this topic, one of the things that we were able to explore in the podcast a little bit is sort of the role of a primary care provider, the pediatrician, and that they will do some screenings as part of those child visits. They'll do some behavioral and emotional health screenings. Allison, are you able to talk a little bit more about, we've talked about how the pediatrician may be able to help out as one of the stakeholders and one of the caregivers in a way. Can you talk a little bit more about what might come up in those preventive care visits?
Yeah, most certainly. It really differs. It really varies depending upon your pediatrician's practice with respect to assessments and screeners questionnaires that they may be administering. We're seeing more and more the integration, though, as you mentioned, of social and emotional health concerns within these child visits. So don't be surprised if you come to your pediatrician's office and they have a questionnaire that really is asking specifically about how your child's social and emotional health is doing. So they may ask you as a caregiver to complete a questionnaire about your perception. They also may be asking your child to be completing a questionnaire about their own perception of how things are going. So again, don't be surprised if you see this more often. During your visit with your provider, they may be asking questions related to your child's social functioning, your child's emotional functioning, how they're doing. And so these might be things that come up just over the course of conversation. I'd really encourage all the listeners to keep track of those sorts of questions that you have. Like we said, as Honora mentioned, your primary care provider is a great resource. Sometimes those visits there's lots going on. There might be vaccinations, there might be, questions related to a rash that came up or something, that kind of popped up unannounced. And so you'll want to make sure, because that time with your provider is very valuable. So make sure to bring your list of questions. And if you are trying to get consultation with your primary care provider, and you have questions about your child's health that you're not really sure are appropriate to share with the child, him or herself, you could always request, an opportunity to speak privately, or is there a way that you can submit those questions? A lot of offices right now have electronic communication systems, things like MyChart and the like, where those questions can be submitted ahead of time. And then you as a caregiver can say, hey, I really don't want this brought up like in the office, but I would love an opportunity to talk with you more about this. So just a couple of tips, what to expect when you go to the doctors, how to navigate those questions like in office. And lastly, if you are planning to bring up questions, like if you have your list of questions and you are planning to talk with your primary care provider about that was a nice conversation for you to have with your child too. Like, hey, we're going to get Dr. So-and-so's opinion about this, as well. So we'd really love you to be a part of that conversation, just so that they're not surprised.
That's great, and I want to come back to those, but I also want to make sure that and some of the screenings I recall from my kids' visits to the pediatrician. But Drew, I wanted to check in. Do we have anything? I know we received some other questions in advance. Do we have anything else that we want to bring in from our members?
Absolutely. We got another one that actually came in recently. We just caught on to it. And then just for future awareness, we actually have another voicemail that we can bring on later on in the show. So let me bring this question up for you. And everybody, please continue to leave your comments. So our member asks, how long does dependent coverage last? Until they're 18, 23, or 26?
That is a great question, and we get this more often than I initially thought we would get when I first started working at AFSPA. So, FEHB and Affordable Care Act and also requires this, but under the FEHB program, your children can be covered until they turn 26. Now, they do not have to be financially dependent upon you. They don't have to live with you. There's no requirement that they remain full-time students, which a lot of that I remember from growing up, and that sort of maybe betrays my age, pre-ACA, but there was the requirement full-time student. None of that applies. They don't have to live with you. They don't have to talk to you. They don't have to remain single, any of that. They can even have their own coverage through an employer or a spouse, another program, et cetera. There's coordination of benefits. If that's the case, if they have another insurance, let your plan know. Make sure that other plan knows that they've got foreign service benefit plan or another, but they are covered until they're age 26. When they hit age 26, they do have the opportunity to continue their coverage under what's known as temporary continuation of coverage, or TCC, but this involves them paying 100% of the premium plus a little bit more for administrative costs, and it's time limited. So it's not a long-term solution, but there can be some continuing coverage at that time, but it's until age 26. So thank you, Drew. Great question. And great question to the member who asked it. Thank you.
Okay, I can bring up the next one unless you wanted to move to a voicemail. Kyle, I don't know if you had a preference.
Sure, if we've got another voicemail, I love hearing all the ways we can.
I think Honor and Allison might have interest as well, so let me just bring this up.
Hi, I'm having difficulty producing enough breast milk for my infant, and I'm being pressured to switch to formula because of this in my work schedule. Can you recommend any resources to assist me in making the correct decision for me and my baby? Thank you.
And thank you for that question, for calling in with it. This is a very personal thing, and I will just say I clearly do not have personal experience with this myself, but I do in my own family and from friends. And I think a lot of people think that breastfeeding is just supposed to happen and it's magical, and that everything's supposed to be perfect and you'll produce enough milk and the baby will latch perfectly and everything will be great. And that is not the case. And if it doesn't happen that way, it does not mean that there's anything wrong with you or that you're not a good mom or anything like that. And so I just want to start there, because everybody's body is different and everybody experiences different things in life in different ways. And that is, we do have a benefit within the Foreign Service Benefit Plan for breastfeeding support, and that includes counseling. And there are lactation consultants out there. You may have worked with one when you were in the hospital immediately following delivery, but there are lactation consultants out there, and you can find them and engage with them. And there is coverage for that under the Foreign Service Benefit Plan. I'll also encourage you to take a look at womenshealth.gov. They have some resources on breastfeeding, including articles that specifically address low milk supply. There's also a plethora of articles about breastfeeding on healthychildren.org from the American Academy of Pediatrics that I mentioned earlier. And if you go to kidshealth.org, and we've done some things with them in the past, including our first podcast this month featured Dr. Elena Pearl Ben Joseph, who does some editing for Kids Health. And if you go to kidshealth.org, and there's a section for parents, it's a whole section on pregnancy and baby, which includes articles on breastfeeding. And there's a specific one on breastfeeding versus formula. So you make the right decision for you and for your family. That's obviously a conversation between you and your doctor and the pediatrician. But there are resources available, and if you need some additional guidance, please feel free to contact us directly, and a health benefits officer I can advise you of what those specific benefits are. I think we just had I think so. I'm gonna pause there because I think that's sort of outside of the at least clinical expertise of Allison and Honora. So unless you all have anything to add, we can move to our next question. Drew, what have you got for us?
Yeah, I actually had somebody was curious about some of our programs, so I will bring this up. A member was wondering what Brightline is, as we have a new partnership, and they want to know how they know if they're eligible.
Excellent. So, Honora, we've been working to get the partnership with Brightline since last April is when I first found out about Brightline and that it exists. And at that point, you all were only in Massachusetts and California, I think. And what a difference, honestly, like 8 months made, because things were in place earlier this year with a nationwide support. So I'll preface this before I turn to you that Brightline is available right now only to members located in the United States. And Honor, maybe you can kick us off telling us a bit about what we're talking about.
Absolutely. I will do my best to be as concise as possible. I've always struggled, particularly just naming what it is. So, in short, while still trying to be comprehensive, Brightline is a family-centered pediatric behavioral health home. What that means is we are at this time, only a telehealth model, so available via technology. We have we have a few tiers of care or ways that we support families regarding their pediatric behavioral health needs. And it looks like the following. So, and anyone can go check out the hellobrightline.com website to learn more. But ultimately, the 3 levels of support that Brightline can provide to your children of many ages, from infancy all the way until age 18, is initially we have something called Connect. Connect is our library of resources that includes media, articles, collections, interactive tools, things that are available to anyone joining Brightline. And I do believe those Connect resources may be available for folks outside the US, but I think that's still something we're figuring out. So I'll defer to you, Kyle, later about that. But ultimately, this is a wealth of resources, sort of, written or co-written by professional writers and clinicians on staff at Brightline. So from child psychiatrists to psychologists and social workers. In addition, outside of the collection, what you have as an option to you is the first level of care or support is behavioral health coaching. These are behavioral health coaches who have some national certifications, master's degrees, and what they can support families with is more subclinical or emerging presentations of concern. So what they do is they work with families, ages like 18 months to 18 with different types of interventions, all empirically based or research backed, using tools like cognitive behavioral therapy to support you and your family. So the areas that coaches can support you with are everything from sleep hygiene and tantrums. So some normative things that can arise, but you may need some support. And those are really caregiver directed or parent directed interventions. But they also do work for children and teens that can be more around organizational skill setting or skill building rather. It can be around self-esteem, emerging fear. So a lot of sort of emerging concerns that can arise for children's behavioral health, and coaches work alongside you both via a live chat or an asynchronous chat, as well as an in-person, or rather in-person and telehealth world, so via Zoom support with you and your family. And then beyond coaching, we have our clinical care services. So there was the Connect library of resources. There was then the behavioral health coaching around more subclinical, but still emerging concerns. And then there is care. So this is the third and final tier that Brightline offers. And this is where you will have, clinically based care, meaning you are working with, licensed clinical providers ranging from psychologists to master's level clinicians with independent licensees across every state. We are currently staffed and equipped. And working to do behavioral health interventions that are evidence-based, including areas of cognitive behavioral therapy, et cetera. Happy to speak through those specifics, and they're treating your child and your family. So they are treating, speaking a little bit to the eligibility question, we're a generalist approach. So we treat areas ranging from anxiety to depression to trauma to conduct or disruptive behavior. We really do treat a range of concerns. And I will say one thing that distinguishes, care from coaching is we can do therapy for ages around age 6 to age 18. For many reasons that may be very obvious, it's harder to engage younger than a 6-year-old in telehealth. So that's a big challenge for us as therapists, but also just what may be clinically appropriate. But in addition to the pediatric, the behavioral health, meaning the behavioral therapy, et cetera, done by clinicians, we also have in our care model speech language pathologists, so to support with language skills and socio-emotional learning, as well as our prescriber team. So our medication management team can also conduct evaluations as well as support with medication and prescription.
So important. Yeah.
Yes. Yeah.
Yeah.
So those are in summary, those are the different levels of care. Those are the ways that one can engage at Brightline. In terms of eligibility, when you sign on or create a membership at Brightline, there are a number of tools that can support you in understanding whether or not you're eligible. As Kyle mentioned, first and foremost, if you're interested in coaching or care, you'll have to be based in the US. Beyond that, you could actually request a phone call from one of our member support specialists to talk more about what's going on for you and your family, to get a better sense if this will be the right fit for you. Beyond that, there is actually a triage model that we have where every family, similar to what we were talking to before around behavioral health screening tools, we have a screening tool that we have to better understand what may be the better pathway for you and your family, whether that is coaching or care. And in either of those situations, whether it's coaching as a first step or care as a first step, we can conduct an evaluation and work with you to better understand what's happening and consider what would be most clinically appropriate to meet the needs of you and your family. So there are multiple ways to sort of check eligibility. Beyond that, there is also, prior to even scheduling a first session, there is a button to sort of check your coverage. So if you're concerned about that, we have an internal model to ensure that you feel like, or that you understand your coverage. Of course, Kyle and your team can absolutely speak to that in much more depth. But in addition, when you speak to a member, if you'd like to speak to a member support specialist about just what's happening for your family and if Brightline's the right fit, you can also ask them about coverage.
Absolutely.
Yeah.
And I'll direct our members to hellobrightline.com/FSBP, like Foreign Service Benefit Plan. So for Foreign Service Benefit Plan members, that is the best way for you to access Brightline services. We're approaching the end of our half hour, but we'll go a little bit over because we've had some questions come in. Drew, what do we got?
Yeah, absolutely. I'd really like to bring this question up from YouTube. I'll just preface it because they sent in multiple comments real quick. So AKB on YouTube asks, just describes, I'm having trouble finding a children's counselor that's covered with FSBP, and they're in the DMV and they're having some frustration using the member provider finder, and they find that it's inaccurate. So they're asking, does FSBP have a list of family or child counselors in DMV area? What should they do?
And so thanks, Drew, and thank you, AKB on YouTube. I appreciate this question. The provider search tool is as up to date as it can be. Sometimes the providers may change status and we don't find out about it until after they've changed the status. So we try to keep that as up to date as needed, but that does not mean it's any less frustrating for you when you're looking for an in-network provider. I want to note two things. One, providers are covered even if they're out of network. Obviously, it's a different coverage if you're going to an out of network provider. It's 70% of the plan allowance rather than the 90% that we would pay. So I think you're looking for somebody who's in network, and finding that particularly in the DMV area, and particularly somebody with a children's focus can be a challenge. I would encourage that person, feel free to reach out to me. I may have some additional information that might be helpful, or we can walk through some things, because we do have an ongoing regular outreach effort to behavioral health specialists, particularly in the national capital region, to try to bring them in network. We are finding that there's occasionally a shortage of providers who are just graduating with the necessary credentials, and a shortage further that of people who are going and accepting insurance, because they often can, maybe a one-person practice, and filing the paperwork may be more than they can take on, and people are willing to pay more. I found this in my own experience in going to a counselor, that he didn't do insurance, and people were paying what he asked. It was hard to get an appointment when I need one. So that's not to say that we are not here to help you. I just want to say I sympathize. I hear what you're saying, and please feel free to contact me directly, and I'll be happy to do what I can to help you. And I will just add, maybe as our last point, Allison, I'll turn to you and just ask, in a situation like this, is there a way that Brightline might provide a solution if we're having trouble finding somebody in person for counseling needs? It sounds like that might be a way that Brightline can help meet the need for child counseling.
Yeah, Kyle. So, I'm not sure what kind of treatment the member is looking for their child, but Brightline is a virtual health solution. So we would be offering telehealth services, and we are covered in that area. So I'd really encourage the member to consider taking a look at our offerings. You can also always kind of try a consultation. Like, is your child going to be able to connect through telehealth? I think our kids spend a lot of time online, and we may be surprised about their ability to forge those relationships and respond to those interventions. That being said, telehealth isn't the best fit model for all youth and families. And so if you are looking for an in-person provider, I just want to echo what Kyle said, that, we are in a pediatric behavioral health crisis and a mental health crisis in general. There are not enough providers available to be seeing folks, especially in person. And that's part of what Brightline grew out of, to address this need. But if you are someone whose needs are best fit in an in-person setting, Brightline, if you came to us and it wasn't the right fit, we're committed to trying to help you get connected. That being said, we are a nationwide solution. And so we don't have our finger on the pulse of all communities all of the time. We'd likely be, directing you to how to navigate this process, giving you some tools to identify potential in-network supports in your community that are seeing folks in person. If this kiddo is school aged, that's a great place to consider, because a lot of those outpatient therapists are full at this time. And so, getting connected at your school and seeing if they're offering counseling services there might be something that maybe the member hasn't considered. Again, pediatrician's office is also another great place to start, because often referrals might be able to come directly from there. Honor, I don't know if you can speak any more to that. Yeah, it is certainly a challenge, and I'd encourage you to check out what we can offer at Brightline, because we're available right now for your child.
All right, Honor, did you have anything to add?
Nope, I think Allison covered
Okay.
it, but yeah, it never
Good.
hurts to reach out and try a consult with us. We're happy to support you, direct you, offer clarity and evaluation, and advocate from there alongside you.
Absolutely. And I will just put a plug in for what Allison said in terms of using school-based resources. And we talked about this more earlier. I will speak from personal experience in elementary school, going to the counselor on pretty much a weekly basis for some challenges in my own life, like that one of the best relationships that I had, and for support. So don't hesitate to look to those resources as well. And they may also be able to refer you further. And I also will note, with Brightline, in-network coverage. So for those telehealth visits, so look to that is covered, and you do have the in-network co-insurance that's there. But check out hellobrightline.com/FSBP. Also check out the podcast through AFSPA Talks that featured both Honora and Allison. It was out there on Monday. Find it on your favorite podcast app or on our website. And I think that brings us to the end of a little longer than half an hour. And I also want to put in a final plug because we had this question from Shelley earlier. We have a fantastic blog also at afspa.org/blogs. And you can find some information there, including about immunizations and some preventive care information. And go back into the catalog because we also have something on breastfeeding and a number of other topics that may be of interest to you also. Please check that out. And I see my colleagues are on top of it. They can type blogs faster than I can pronounce it. So thank you all. Drew, thank you very much. And to the rest of the team behind the scenes, and Allison and Honora, thank you all for joining us today. Stay tuned, subscribe to AFSPA Talks. We've got a great lineup for you in the month of September and beyond. And we'll be back here for AFSPA Live the last Thursday of September, and we'll see you then.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.